This is the question. Like I told you guys all the time, focus on the chief complaint. Try to make the diagnosis based on information given you, and you'll be able to answer the questions carefully. Read through it as provided. So we have a 50-year-old female in the emergency room. A 50-year-old female presents to the emergency room with acute, so sudden onset of where? Location, pay attention. Right upper quadrant pain after hamburger lunch. So I had some lunch. By eating hamburger. The pain is colic. That means on and off. In nature, it can be colic in nature, go back and forth, episodic. And radiate to the right shoulder. Something should be ringing in your ear. We have 50-year-old female who has right upper quadrant pain. And then pain go to the the scapula, the right side, which is almost the same as right shoulder. Some nausea, but no vomit. Patient had previous episode that resolved in an hour 3 months ago. This pain has lasted for 6 hours, so this pain never resolved. She feels warm. She tries sometimes an omeprazole without relief, and the pain is rated at 6 out of 10. Past medical history of hyperlipidemia. She has 4 C-section, occasionally drink. When exams are late oriented, she's febrile, slightly tachycardic, SATs and blood pressure is normal. She has what? Inspirational arrest with deep palpation of the right upper quadrant. Summary, 50 years old. She's female and she's over 40, right? And she has pain after eating by the food. And the pain is on the right upper quadrant. She has some vomit. It goes to the scapula. She tries sometimes, it's not helping. She's fertile. She has 4 what? C-section. So very fertile. And she has right upper quadrant pain with inspiration arrest. This is what we call Murphy sign. So you push on the right upper quadrant and then they start arrest. Arrest means they stop breathing briefly because the diaphragm descends to the right upper quadrant and touches the inflamed gallbladder, and then they stop breathing. That's what we call Murphy sign, right upper quadrant pain. So based on these symptoms and signs and symptoms I've provided, I've given you a bunch of the herbs consistent with what? Cholecystitis. Cholecystitis, and she has fever. So this patient has acute cholecystitis, and you know how to manage it. It's a GI pathology with, and therefore the management should be easy for you. What do? The next anticipated presumptive diagnosis is what? I already told you. It's not appendicitis because the appendix is on the right lower quadrant. This is test-taking skills, critical thinking. Diverticulitis is on the left lower quadrant. Pancreatitis is located in the mid-epigastric area. Therefore, even if you don't know, you can eliminate A, B, C, and then you'll be left with cholecystitis located at the right upper quadrant. Select or apply based on the next anticipated diagnosis. GI pathology with itis, inflammation, constant, always the same. What is indicated? You need to make them NPO. If they NPO, they need IV fluid. They don't need TPN. You need to check their lab. Since they have cholecystitis, we need to check their liver function. This is how we can see if there's a the bilirubin is elevated or if there's obstruction there. So we check this. Anti-infective, antibiotic, yes. NG tube, she's not vomiting. She may need surgery, okay. Ultrasound to make the diagnosis. So she may need surgery, so This is indicated, but not immediately. So this is all indicated, this is anticipated because she's had this episode before. So she may need surgery. It's most of the time when they come in their previous episode, this has cholecystitis inflammation. She will need surgery. We need an ultrasound to look at the gallbladder. We give the antibiotic. We check her LFTs to look at whether bilirubin is elevated. We make them MPO and give them IV fluid. This is the management of acute cholecystitis. I'm doing this series to give you all the GI pathology. What are the possible ways they're going to ask you questions? So this is what you do with acute cholecystitis. MPO, IV fluid, get the LFTs to see the bilirubin. So you get the AST, ALT, bilirubin. They get an antibiotic because it's an IDs. They will need surgery. You get an ultrasound, right upper quadrant ultrasound to look at the gallbladder. So this is your first question, and I hope you learned something out of it. Take care of yourself and expect the second one following and follow the series.